Thanks so much for having me. My name is Megan Pike. I'm a pediatric hematologist in Halifax, and I will be sharing some information with you today about anemia and iron deficiency in adolescents. So here's what we'll cover today. We'll talk about the role of iron in our bodies, and then I'll define for you what iron deficiency and anemia mean. I'll talk about some of the causes of iron deficiency and anemia, especially those that are most common in teenagers. And then I'll share with you some common symptoms of iron deficiency or anemia and how you and your healthcare provider can make a diagnosis. And then I'll review some treatments for iron deficiency and anemia and some pros and cons of each of the different options. So what is the role of iron in our bodies? So iron is a molecule that serves as a building block for something called ATP, which is an energy molecule that all of our cells use. So iron essentially is essential to generate energy in our body. Iron is also a part of hemoglobin. Hemoglobin makes up red blood cells. And red blood cells are what circulate in our blood to bring oxygen all over our body. So to provide oxygen to all of our muscles and tissues and all of our organs. So hemoglobin carries oxygen on a red blood cell, but it requires iron in order to do that. And so what causes iron deficiency? So iron deficiency means that someone has low iron. And usually that happens when the body's demand for iron exceeds the supply. So there isn't enough iron to keep up with the body's energy needs. This actually affects almost 40% of adolescents and is more common in females than males. Iron levels can be measured by calculating a circulating iron. So that means that a healthcare professional would take your blood work and measure the amount of iron circulating in your blood at any given time. This isn't very accurate because if you just ate a steak, for example, and then had your iron checked, it could be high, but that's not a reflection of your iron stores. And iron stores are how we use iron for energy. So the way we measure iron stores is by measuring something in the blood called ferritin. That's a blood test that your healthcare provider would order. And the ferritin gives an idea of iron stores. Here in Canada, we accept a ferritin greater than 20 or 30. And ideally, especially if someone is having symptoms of iron deficiency, I sometimes target a ferritin greater than 50. It's not uncommon for teenagers, especially females who are having regular periods, to have a ferritin in the 20s and 30s. Unless they're symptomatic, it doesn't need to be treated. So the ideal ferritin level really depends on the person. Iron deficiency, if left untreated, can cause anemia. So it can cause hemoglobin to be low. And that's because, as I showed you, iron is essential to building hemoglobin. And so iron deficiency and anemia are different. It is possible to be iron deficient and not anemic. So if you're worried about iron deficiency, it's not enough just to measure hemoglobin. You should also ask your healthcare provider to measure a ferritin. So what can cause iron deficiency that can lead to anemia? By far the most common causes in growing teenagers are decreased iron in the diet and heavy menstrual bleeding. So that's heavy periods. Some teenagers live with what we call bleeding disorders, which means that they're more likely to bleed. For example, they may have frequent nosebleeds. They may bleed from their mouth when they're brushing their teeth, or they may bleed into muscles and joints. Those patients are at risk of iron deficiency because they're losing iron in the blood that they're losing. Decreased iron in the diet is the most common during periods of rapid growth, which is why it's especially true for teenagers because your body is growing so quickly. And People that drink a lot of milk, especially infants drinking close to a liter per day, can interfere with iron absorption. But by far the most common causes of iron deficiency in teens are decreased iron in the diet and heavy periods. So that just brings me to an aside. Given that heavy periods are one of the most common causes of iron deficiency, how do you know if you have heavy periods? Well, luckily, there's an app for that. So 2 years ago, I released an app called We Thrive, which is designed for adolescents to answer that exact question, are my periods normal? Downloading We Thrive can guide you into tracking your menstrual cycle or by answering a questionnaire that asks questions about your quality of living. And that can help identify heavy menstrual bleeding. So if you follow the instructions on the app, it will do it for you. This is just the handle to our social media pages on Instagram and Twitter. And so you can follow us at We Thrive app. We're also on TikTok, and there's some really helpful posts there to show you how to use the app to identify heavy menstrual bleeding. I also put together a little memory tool for some screening questions that might help identify heavy periods. So if you answer yes to any of these questions, you may be someone that has heavy periods. So do you pass large clots, like greater than a centimeter clots with your menstruation? Have you ever bled every day during your period for 7 days or more? Have you ever had a period so heavy that it stops you from doing something that you want to do, such as going to play sports, swimming, or going to school? Have you ever had to change your product more frequently than every hour? Have you ever flooded past your product onto your clothes, your pajamas, or your bed sheets overnight, or had to wake up overnight to change your product? Have you ever doubled up on products? So have you ever worn 2 pads or a pad and a tampon at the same time? And have you ever soaked through your product onto your pants? So sometimes soaking onto the underwear can be very normal, but if you've soaked past your product and past your underwear, that's a warning sign for heavy periods. So how might you know if you have iron deficiency or anemia? Some patients don't feel any different, but we are able to detect iron deficiency or anemia on blood work. However, the most common symptom with iron deficiency or anemia is fatigue. And that's because, as I showed you, iron is used as a building block for energy. And when we can't build enough energy, we feel tired. In addition, if someone has anemia, they might feel short of breath, lightheaded, or more prone to fainting. Patients with iron deficiency may experience headache, and patients with anemia may look pale, so their skin may look lighter than usual. And sometimes patients that have really severe anemia will complain that their heart is racing, so it feels like their heart is beating out of their chest. Sometimes their healthcare provider can even hear what we call a heart murmur, which is the sound of blood flowing really quickly through the heart. And that can be an indicator for your healthcare provider that you may have anemia. So if you have iron deficiency, how is it treated? These are the things that your doctor should do. So the first is to confirm the diagnosis of iron deficiency with blood work, so measuring hemoglobin and measuring ferritin. The second is to identify the cause of iron deficiency. So it's not enough just to give iron. It's also important that your healthcare provider seek to understand why it is that you are iron deficient. For example, screening for heavy menstrual bleeding or asking questions about your diet. In order to manage the cause, we have to understand what that cause is. And so after knowing what's causing your iron deficiency, your provider can help you with addressing the underlying cause. So sometimes we actually shut down periods for a while, meaning we give a medication that stops a teenager from having periods for a few months so that we can provide iron and replete someone's iron. And then the next step is to provide iron replacement therapy. Most of the time we do this with an oral medication, which means it's taken by mouth. Sometimes we provide iron through an IV or intravenous, which is through a needle. And I'll show you some examples of when we might use that. And then after about 3 months of treatment with iron, your physician will confirm that the therapy was successful by both assessing your symptoms and repeating your blood work. One of the best ways to treat iron deficiency, regardless of its cause, is by increasing iron in your diet. And sometimes we can even prevent growing teenagers from becoming iron deficient by optimizing the amount of iron in their diet. So I just gave some examples here of some foods that I think are acceptable to teenagers that are high in iron content. One of them is dark chocolate, actually. So you can tell your parents to stock up on dark chocolate. Some cereals are really rich in iron, like Raisin Bran and mini wheats, shreddies. They're iron fortified, so that can be really helpful if you like to eat cereal in the morning. Spinach is a really great source of iron. I really encourage patients to put a handful of spinach in their smoothies, whether it be like for breakfast in the morning or after their activities, because you can't really taste it if you put it in a smoothie with some good fruits. Red meats, including pork and beef, lamb, are really high in iron. And some vegetables like broccoli and most nuts, including cashews and almonds, are fairly high in iron content. So these are just some examples of foods that are rich in iron. Your provider may prescribe oral iron that's taken by mouth. They use certain calculations to pick a dose. In general, it's around 3 to 6 milligrams per kilogram per day of iron. So your physician would have to know your weight in order to appropriately dose iron. Most people take their iron once a day. It is also acceptable to take it every second day. And I always recommend that people take their iron supplement at least an hour away from any milk products. So that's like yogurt, cheese, and milk, because milk can interfere with the absorption of iron. It is awesome if someone can remember to take their iron with vitamin C, because vitamin C actually increases the absorption of iron. And you can do that by taking the pill with a glass of apple juice or a glass of orange juice. It's really important if you are prescribed oral iron that you do not miss any doses. Unfortunately, the most common cause of oral iron not working is that someone's not taking it every day. It's important that you take it every day or every second day as prescribed for a minimum of 3 months. Sometimes people can't tolerate this because it's hard on the stomach. So sometimes teenagers will tell me that it makes their stomach hurt, causes nausea or constipation. Really important to let your provider know that, because there are a variety of different iron supplements available and they all have a different side effect profile. I usually start with something called ferrous sulfate, which is the 3rd row down. And if someone can't tolerate that, then there's other types like ferrous fumarate I can use that can be gentler on the stomach. So really important that you take your iron as prescribed. And if it's causing you a stomach upset, to let your provider know that rather than just not taking it. Because if you don't take it, that may be a reason to give IV iron, and that requires a needle. There are some patients for whom we give IV iron rather than the oral iron, even from the start. And that's because they have either chronic kidney disease or a genetic condition called IRITA, which is very rare. But both of those things require that iron be given through an IV. Sometimes patients that have lots of inflammation in their bodies from diseases like celiac disease or like Crohn's disease require IV iron because their gut can't absorb oral iron. The other few reasons to give IV iron is intolerance to, sorry, that should say to oral iron. So if someone has really bad side effects with oral iron, we sometimes switch them to IV. Or if their iron deficiency doesn't improve with oral iron, then we'll switch to an IV. And usually we test this first by doing what we call an oral challenge, where we actually measure an iron level before and after giving oral iron. So all that to say, there are some patients for whom we wouldn't even offer oral iron and we would just go right to an IV. But for most patients, they can do well on oral iron, and only if that doesn't work would we consider doing an IV. IV iron is a big deal because it does require that you come into our clinic for a needle for every dose. If someone weighs more than about 100 pounds, we can do one dose, but if they're less than 100 pounds, we need to do multiple doses of IV iron, sometimes up to 6 doses. So it does mean time off school, getting a needle every time you come in, spending the day in our clinic. The reason that we do this in clinic is to monitor for allergic reactions, which sometimes can be something as common as chills and flushing or redness of the face, but it can be a true allergy that requires an EpiPen, where someone has trouble breathing. And so this is why we don't do IV iron if the oral iron can work. And actually, there has been some really good studies that demonstrate that oral iron is as effective as IV iron as long as it's taken as prescribed. So just to summarize then, iron deficiency is common amongst adolescents and can lead to anemia if it's untreated. The most common symptom of iron deficiency or anemia is fatigue, and the most common cause in teenagers is heavy periods. Iron deficiency can be managed with increasing iron in the diet and or providing medications such as oral or IV iron. Thanks so much for your attention, and I would be happy to take any questions. This is the email for the We Thrive app, and I answer lots of questions there about heavy menstrual bleeding and iron deficiency, and also happy to answer any questions you might have about the app. Thank you.